Good evening. Thank you for being here with us this evening. Tonight, I am pleased to present to Nevadans our state-specific plan for reopening. A copy of the full plan can be found online at nvhealthresponse.nv.gov. Nevada United, Roadmap to Recovery, is designed to build a path forward and safely restart Nevada's economy. As the governor of this great state, a former locally elected official, and most importantly, as a father and as a husband, I share our collective goal of seeing our communities get back to business. We have taken great steps together as a state to keep Nevadans safe against COVID-19. And while we continue to do that, we must now chart a responsible path forward that will get Nevadans back to work under a new normal. This roadmap outlines a coordinated state-specific plan to address the COVID-19 public health and economic crisis. The core guiding principle is that our efforts should be federally supported, state-managed, and locally executed. I am confident that if leaders and stakeholders throughout Nevada work together to accomplish our shared goals, anything is possible, even in the most trying of times. We will do this as quickly and safely as we possibly can with a gradual, phased-in approach. When I first became your governor, I promised to put Nevada's families first. It breaks my heart to see Nevada families suffering because of COVID-19. But this roadmap helps me put the state and our families back on track. I've taken immense pride throughout this crisis whenever I see Nevadans helping Nevadans, and you should too. It's our resiliency and spirit that makes us great. We are battle-born, and right now we are being tested in this battle against COVID-19. Together, we will be Nevada United and battle-proven. The reality is this: no single elected official, business, government entity, or individual Nevadan can accomplish this task alone. All of us have a role to play when it comes to ensuring the Silver State recovers and comes back stronger than ever, but it will require common sense and personal responsibility, and all of us play an important role in this roadmap. In addition to the principle of being federally supported, state-managed, and locally executed, there are a few other guiding principles in this roadmap that should drive our decision-making that I wanted to highlight for Nevadans. First, the timetable for a strong recovery will be determined by the virus and the behavior of Nevadans. The reopening of Nevada will happen the same way the state was closed down, in phases, and following the guidance of the Centers for Disease Control, the CDC, and our medical experts. Secondly, we must all work to ensure our response efforts encompass access for all at-risk populations, including older individuals, lower-income Nevadans, tribal communities, racial and ethnic minorities, vulnerable populations, and our veterans. Finally, the state's management of the recovery and reopening process must remain flexible at all times, with ongoing monitoring of local and statewide data reporting and analysis. The state must maintain the ability to track warning signs in order to prevent an avoidable spread of the virus through an aggressive intervention. Look, I know this can be overwhelming. All this talk about infections, testing, and ventilators over the past 2 months is not something that any of us are used to. I know how most Nevadans are feeling right now. I really do. The fog feels like it's clearing away, and many of you are probably asking why you're sitting at home. Why are schools closed? Why can't you grab a beer with your buddies or go to a game with your family? I get it. I really do. Because we've done such a good job, the threat of COVID-19 feels distant and abstract. To many, it might not feel as scary anymore. But I have the unfortunate responsibility to remind all of us that the threat remains real. Just a month ago, models were predicting high peaks of hospitalization and overloading of our healthcare system, and death tolls potentially in the tens of thousands. We can't forget that. After all, there is still no vaccine for COVID-19 at the present time. This means that in Nevada, the only reason the number of confirmed cases and deaths is not significantly higher is due to the implementation of strong social distancing measures, which is why the criteria for reopening I announced last week are so critical to our future success. I want to give a refresher on the criteria for reopening and a status update as of today. First, consistent and sustainable downward trajectory of COVID-19 cases and a decrease in the trend of COVID-19 hospitalizations over a 14-day period. As for percentage of people testing positive, we reached what appears to be a peak on April 24th, and that rate has been declining since that time. We are watching this trend very carefully. Confirmed COVID hospitalizations are following an overall decrease, but we must evaluate this data carefully to be sure that the decreasing trend is sustained if more suspected cases are confirmed. We will be watching this trend closely. Number two, ensure that our healthcare system is out of crisis mode and able to handle potential new surges in patients, along with non-COVID related services. The hospital system is continuing to indicate an available immediate surge capacity for all-cause or COVID-19 patient influxes. This is a good sign. Number three, expanded ability for healthcare providers to administer tests for symptomatic patients and sufficient laboratory testing capacity to process COVID-19 testing samples. This is where we have some really good news. Due to the hard work of the public health authorities, our incredible Nevada Division of Emergency Management, the Nevada National Guard, local leaders, and more, Nevada now has the capacity to test all symptomatic individuals at this time under the testing guidelines issued by this state. We have met the criteria. We know long-term we will need more testing. We'll be building our capacity to test asymptomatic Nevadans as well, which is one of the primary goals of our response efforts. Number four, sufficient public health workforce capacity in local and state departments to conduct case contact tracing. These efforts continue to ramp up to scale, and I'm so proud of the progress that we have made. We'll be working with the counties and public health authorities to address the immediate and expanded workforce needs for case interview and contact tracing. We feel very positive and are exploring many innovative ways to expand this workforce and be ready for phase one. Number five, sustained ability to protect vulnerable populations. Outbreaks minimized in special settings like health facilities and nursing homes. This is highly qualitative criteria and one we take seriously. We must have and remain safe during this process. Here is what we won't be able to open in phase one. Bars and nightclubs will remain closed, as will malls, large sporting events, large in-person places of worship, and concerts. I know we are all looking forward to these opening up, but due to the density and risk, we will be unable to do so in phase one. And when it comes to our biggest industry, all final decisions on how gaming establishments reopen in the state of Nevada will be determined by the Nevada Gaming Control Board. They will be working closely with local health authorities and medical experts to monitor progress. Here's what I can tell you today. Gaming will not be opening at the start of phase one. We will stay in phase one for a minimum of 2 to 3 weeks, the recommended time frame necessary to evaluate trends in cases and hospitalizations as we relax restrictions. Some of this may sound familiar to those of you keeping track of our plans in fellow states who are navigating the reopening process just like us. But there's something uniquely Nevada about our plan that I want to share with you. And it goes back to our guiding principle of ensuring our roadmap is state managed and locally executed. Up to this point, the state has directed the response efforts for COVID-19 and determined which businesses can remain open under strict conditions and which businesses must close to prevent the spread. These were difficult decisions. I had to make these under unimaginable emergency situations. But in our effort to begin transitioning into more familiar territory, My goal with our state-specific plan is to return to the Nevada style of collective and collaborative governance and decision-making that sets us apart. We may not always agree, but we are one of the few places where political disagreements will not prevent us from working together for the good of our state. I know this in my heart to be true. We don't always have to agree, but if you love Nevada, we're going to do this together. That's why, in order to help us navigate Phase 1 and plan for future phases, we're going to partner with our locally elected officials at the county level who are the experts in their communities. State support and oversight through its existing regulatory and licensing structures will continue, but responsible county governments with their knowledge of unique communities and their existing local licensing and regulatory structures are in the best position to execute the gradual reopening of the businesses and public life of their local residents. Under this state-managed, locally executed roadmap, the state will continue to issue statewide standards and restrictions for each phase under which individuals and businesses must operate that are based on the social distancing requirements necessary to ensure that Nevada's public health care system is able to respond to any surge from COVID-19. Only now, in an effort for Nevada to start returning to the normal structure of government decision-making, the County Commission will have an increasing responsibility for determining the manner in which businesses within its jurisdiction can open and operate in. The main requirement is that county guidance and restrictions must meet or exceed the standards set forth by the state in this new directive. I will be issuing prior to entering into Phase 1. It would be a disservice to the residents and businesses in our state to pretend like Esmeralda County is the same as Nye County, or that Clark is the same as Elko. They're not, and that's okay. That's why our response efforts should reflect our regional differences while still operating under our shared statewide goal of keeping Nevadans safe and restarting our economy.